Hi, my name is Yvonne Eccleston, and the study I've decided to focus on is trauma-focused cognitive behavioral therapy, or TF-CBT. This is the table of content I will be using today as a guide for my presentation. There are 5 parts to my table of content. The first one is the introduction, part 1, part 2, part 3, and part 4. For my introduction, I thought these 2 questions would help me with explaining what TF-CBT is all about. The first question is, what is trauma-focused cognitive behavioral therapy, or TF-CBT? Well, TF-CBT is basically the joining of the child and parent psychotherapy approach for children and adolescents who are either experiencing or have experienced significant emotional, behavioral problems, and difficulties related to a traumatic life event. The second one is, who is trauma-focused cognitive behavioral therapy for? Well, TF-CBT is for children and adolescents from ages 3 to 18 who have significant emotional problems such as PTSD, fear, anxiety, or depression that are related to a traumatic life event. In part 1, there are 3 questions that have to be answered. The first one is, what is the problem being addressed in TF-CBT? Well, the problem being addressed in TF-CBT is used to help children and adolescents suffering from a traumatic life event with the use of the triangle in TF-CBT, which is used to help us understand what is happening in a child's mind. At the top of the triangle, it says thoughts create feelings. The bottom right, feelings create behavior, and then behavior reinforces the thoughts. The triangle helps children and adolescents understand what they are feeling and how it relates back to their behavior. The second question is, why should social work be concerned? Social work should be concerned about TF-CBT because not only is it helpful to the client, but to the clinical social workers that help children and adolescents to recover from a tragic event. Because TF-CBT helps children and adolescents start to heal by retelling the event in a safe environment. Why should society be concerned? Society should be concerned because there are a lot of children that are suffering from many emotional problems caused by a tragic event. Many parents with children and adolescents who have emotional problems due to a tragic life event have trouble finding a helpful method to help their children, help them to start to heal. TF-CBT helps children with an emotional problem that is a result of a tragic life event. It gives children an outlet to speak about their feelings freely without being judged. This video is a demonstration of what TF-CBT is all about. This video is about a young girl going through a tough time after her grandmother passed away. Let me start the video.
Okay, Carrie. Well, I'm really glad to hear that things are going a little bit better this week. And I was hoping that we could take a little bit of time and review what we talked about last week, where we were looking at that cognitive triangle, and we were talking about some thoughts that you were having around homework that were pretty unhelpful for you. So, then we're going to do another example of it, maybe looking at some thoughts that you're having around Grandma's death, okay? But first, I just wanted to go over that triangle again. So do you want to do blue paper first or purple paper first? got all kinds of thoughts and feelings and emotions and stuff about homework. And sometimes it gets a little frustrating. But we know that all of these things are really interconnected. So you remember that, what was one example of a really unhelpful thought that you were having when you were getting stuck doing homework?
I think like I'm too stupid to do it.
Okay, that's that really unhelpful one. I'm too stupid to do this. And when you're kind of thinking, boy, I'm too stupid to do this, what are you feeling at that time? How's that make you feel?
Like I feel mad and like bad about myself. Like I'm not good.
Okay, thinking maybe I'm not good enough to do this, or yeah. Okay.
Like I'm just like frustrated.
Frustrated, yeah. That's understandable. So what happens when you get kind of in that place where you're mad and frustrated, feeling like I'm just thinking I'm too stupid to do this? And then what happens? What are kind of the actions that come out of that?
Well, most of the time I just don't want to do it anymore. Like this, like one time I got really mad and I crumpled my paper up.
Okay.
And then I got in trouble. Like my teacher, when I turned it in, I tried to flatten it out, but it didn't work, and I got in trouble. So I felt bad about it.
Okay. So there you said you crumpled up your paper because you were feeling so upset and you got in trouble, and then that even pushed you back to feelings where you got sad about getting in trouble, and you can see how these all kind of connect to each other, right?
Yeah.
Well, you did a really nice job last week of coming up with kind of a different thought that you could have that would help you get through that point where you felt really stuck doing your homework and then we were thinking, boy, maybe I'm too stupid to do this. Do you remember what that thought was?
It was like it's hard, but that's why we're learning it.
Nice. It's hard, but that's why we're learning it. Okay. Do you have any other thoughts that were pretty helpful for you?
Or like, probably like everybody, it's hard for everybody.
Yeah, it's hard for everybody. So, when you kind of switch the way you're thinking from I'm too stupid to do this to it's hard but that's why we're learning, or it's hard for everybody, then what kind of feelings come up when you're thinking that way instead?
Like, I don't know, I feel better about my, like I feel smarter and I'm not really bad anymore.
Okay.
Like, I'm not feeling happy to do homework, but I don't feel bad, like mad or...
Not feeling sad, not mad. Okay. Feeling okay about it?
It's okay,
Thinking I'm gonna do it. Okay. So maybe feeling more determined or more...
Yeah.
Okay. And I know I kind of put that word in your mouth, but...
No, that's what I meant. My teacher says that.
Cool. So what happens when you switch your thinking, and then it kind of changes your feelings? You're feeling smarter, maybe more determined, and then what ends up happening? What are your actions then?
Then I'm like, I can go through it like super fast, and I'm really good at it. Then it seems like I'm just like one time I saw this show where they were answering the questions really fast on the show, and I feel like that, like I'm on a game show. Like
Cool.
I'm going really fast.
Neat. Awesome. So you're like on a game show.
Yeah.
Oh, cool. And when you get done with your homework, what gets to happen?
Well, then I get free time. I like to either play the PlayStation or watch TV.
Gotcha. So cool. So something really good comes out of it. So you started out feeling a little frustrated with your homework, and that kind of makes you feel bad. And sometimes you get so mad you crumple up your paper, but if you know that if you kind of change your thinking about it, like, well, it's hard, but that's why we're learning, and everybody's learning, feeling more determined, a little bit smarter, and then you get to the good stuff. You get through that homework and get to do the really fun stuff. Cool. Okay, Carrie, I'm hoping that you and I can maybe work this triangle. We're going to do another example.
Okay, well, I'm going to stop this video right here. this was a great video in showing what TF-CBT is really all about. Let's see. In part 3, we actually have a picture of the triangle, where it starts from the top is the thoughts create feelings, bottom right is feelings create behavior, and then behavior reinforces thoughts. I think that TF-CBT can be a valuable asset to clinical social work, adolescents, and children with emotional problems, as well as society, because many children are apprehensive about speaking with adults after a tragic life event such as rape, sexual abuse, physical abuse, or death. These children and adolescents may be very wary about speaking with another adult about their problem because they already felt victimized the first time. They don't want to feel re-victimized if they talk to another adult and the same thing reoccurs. So this is why this treatment is heavily supported by Project BEST, who feels that this form of treatment is very helpful to children and adolescents suffering from emotional problems due to a tragic life event. And I agree with them as also, because it's very helpful with getting children to speak about their problems without feeling pressured or feeling like their voices are going to be ignored or feeling like they're just going to be re-victimized. And that's why I love this therapy, because it helps them get through it. And in part 4, many of the studies for TF-CBT are being done mostly in Europe or England. There are, however, many studies that have been done in the United States. When evaluating the program, the researchers should do a pre-test, a post-test, and a follow-up. 12 months later, the follow-up is done to determine if the program was effective in helping the children and adolescents with their emotional problems or behavioral problems as well. We can determine that the prevention of emotional problems due to a tragic life event can be treated effectively based on how many children and adolescents have improved. And these are my references, and I hope you had a great time listening to what I have to say today. Thank you.